I think the European region has a lot to show to other regions in how we approach the needs of countries and how we work at the countries.
The WHO Regional Office for Europe has country offices in 30 of the 53 countries in its region. These offices, which range in size from 2 to 60 staff, allow ministries of health and other partners to work directly and closely with WHO.
We need to make sure that the investments of WHO in the countries are appropriate and that they give results. But it's very difficult to judge from outside how the country offices in reality work. So we agreed that it would be necessary to visit at least some of the countries and see how everything works in practice.
In 2017, WHO Europe invited European members of the Executive Board and members of the Standing Committee of the Regional Committee to visit country offices to gain first-hand insight into WHO's work at the country level and the added value it brings to achieve positive outcomes for health. All members of the Standing Committee took part in the first country office visit in Georgia in November 2017. This was followed by 3 visits with smaller groups in early 2018 to Slovenia, the Russian Federation, and Turkey.
We met different people from the Ministry of Health and academics and NGOs, etc. And what I realized that there was a common voice, that everybody told us that they believe in the WHO and the country office regarding the expertise. And whenever they turned to the office, they got the proper answer or the proper information. So the message was to me is that the WHO and the country office has a credibility in Turkey.
I was surprised and positive, in a positive way, how good they work together. And I think the leadership of the Ministry of Health is very important for such a strong collaboration with the country office, and I think it helps a lot for the benefit for the people in the country.
The visits illustrated WHO's country work in varied contexts and gave members of governing bodies an opportunity to hear directly from partners at the country level, including ministers of health.
Поэтому мы благодарны высоким профессионалам, которые работают в страновом офисе, и считаем, что это часть, в том числе методологическая, организационная часть нашей общей команды системы здравоохранения Российской Федерации.
Technical cooperation between Slovenia and WHO Europe and all its units is extremely good, in particular in the last decade. We have done a lot of work together in improving health system performance, then in tobacco control, as well as in reducing health inequalities.
Tabii Türkiye sağlıkta dönüşümü 2003 yılında başladığında göstergeleri iyi olmayan bir ülkeydi. Özellikle anne ölümü, bebek ölüm oranları gibi. Bu son 15 yıllık serüvende Dünya Sağlık Örgütü ile bir işbirliği yapıyor Türkiye ve bu işbirliğiyle Türkiye sağlıkta bir dönüşüm gerçekleştirdi, bir model ortaya koydu.
Together, WHO country offices and their host countries are meeting difficult health challenges. The Turkey country office and the field office in Gaziantep manage a complex health response spanning regions, countries, and cultures. WHO brings together a range of partners, donors, volunteers, and health workers to provide medical services for Syrian refugees and coordinate the cross-border health response in northern Syria. It is a remarkable feat of partnership.
And then there's a whole network of coordinated action that takes place. People are met and greeted and told you are welcome and you are safe. Possibly the single most impacting message that they've had. Many people have come back and told us for their mental health, that has been the singular thing that has made them feel I'm a human being.
The WHO European Office for the Prevention and Control of Non-Communicable Diseases, co-located with the country office in Moscow, is leading work on strengthening the NCD response in all 53 countries, with strong support from the Russian Federation.
Having a GDO, which is a technical unit, in this case very advanced and with a very big technical capacity, is important because we are close to the action. We are in the part of Europe where NCDs are more prevalent and they kill more people.
WHO country offices are also supporting countries to spur progress towards achieving ambitious health goals laid out in the 2030 Sustainable Development Agenda and the Health 2020 policy framework.
Universal health coverage is about getting the services to those who need it at where they need it. And this is a huge opportunity for the country office. We are really connecting. We can see that this office will manage in advocating for applying all these values and principles from the Agenda 2030 into the implementation locally.
The future collaboration has to look into making sure that no one is left behind from the point of view of the services. But in the context of Turkey and a country which is responding to the regional crisis is also to find solutions to make the world a better and safer place and to be able to support the other countries and the regions when it is needed.
The newly adopted 13th General Program of Work gives WHO a mandate to further strengthen its country-level work in the coming 5 years. The country visits illustrate WHO's day-to-day work in countries, but also show how the 3 levels of WHO come together to improve health. With this information, members of governing bodies can make clearer decisions about the work and funding of WHO.
I'm sure that the representatives of governing bodies now understand that even a small office with very low resources from the budget of WHO can bring a big difference and can be of big value to the country in health development and health investments.
It certainly has enhanced and deepened my ideas about it, and also gives me a lot more information and things to discuss and food for thought, and how we can do things better or how we can do things differently.
Мы же прекрасно знаем, что дружба – это очное понятие. Можно сколько угодно переписываться по имейлу или перезваниваться, но вы должны к маме ходить, вы должны другу жать руку, и вы должны с другим профессионалом обговаривать это все, глядя в глаза. Искренность – это основа принятия решений. Искренность и правда.
Country office staff are at the forefront in implementing our commitments. Everything we do with and for the countries, putting their health needs at the core. I would like to thank all member states for their commitment and excellent collaboration towards better health and well-being of the European population.